So thank you, sir. Thank you all. And it's a time to start the international session. Today is the 1772nd day of uninterrupted daily webinar of IFPH. Before beginning the session, let's have a silent prayer. Hello, doctors, friends of homeopathy, and students of homeopathy. Today is the 1772nd day of uninterrupted daily webinar of IFPH. Today's our presenter is the great teacher, Dr. KULWANT SINGH, ex-dean, Faculty of Homeopathy, Vinoba Bhave University, Hazaribagh, Jharkhand, Principal, Singhbhum Homeopathic Medical College and Hospital, Jamshedpur. From 2000, he is the principal of this institution. He is a teacher who is having 43 years of meritorious experience. He is the resource person of various seminars, CCH workshops, examiner and paper setter. And today, our session is the second part of rheumatoid arthritis and its homeopathic perspective. In the previous session, we studied a lot of things, the differential diagnosis of osteoarthritis and rheumatoid arthritis, the complications, and we are going to continue the second part, and you are able to view the first part in the YouTube. It's being uploaded there. You can go through that session. So you are welcome to the session, and I welcome you all for this session. Let's have. Sir, you can unmute yourself.
Can we start, sir?
Yes, sir.
Thank you. Welcome. I'm thankful to all members and team of the IFPH. And without wasting any time, we should start and should come out with the second part of the presentation, that was rheumatoid arthritis. Today, we will discuss the treatment part of this disease. We have discussed all aspects of this disease in the last lecture. And the gist was, the summary was that there are 7 critical points that this disease, pain in joints, swelling, it was having 7 clearly diagnostic features. That one is, it is symmetrical, happens on both sides. Second is, there is swelling. Third is sensitiveness. Fourth is stiffness. Fifth is, there are structural changes, that is deformity. Sixth was symmetric, systematic effects on other parts, systemic effects on other parts. And seventh was, occasionally it was seropositive. Let us start today's lecture. I welcome you all. But before going to the treatment part of this disease, I would like to touch one very important part which has come to picture since a few years, recent development, and where this disease is related very seriously with the gut, that is the digestive tract. So it has been observed, it has been found that gut problems have a direct impact on this problem, and they can create some symptoms of rheumatoid arthritis. You can see this is a gut RA axis, gut rheumatoid arthritis axis. This axis is the causative factor. So many times you can see 70% of the immune system is controlled by gut. We know that this disease is due to the disturbance of the immune system, due to dysregulation of the immune system, and it is clearly fact has been established that this problem, 70% of the immune system is controlled by the gut. So what happens due to the problem in the gut? What happens that the patient comes to suffer from rheumatoid arthritis? Some very small knowledge about the gut, that it is having 30 trillion human cells. We are having 30 trillion human cells in the body, whereas there are 38 trillion bacteria in the gut. There are 100 trillion microbes in the gut. So that itself indicates that it is more than the cells in the gut body. So many of bacteria, so many of microbes Microbe is a combination of bacteria, virus, fungus, and other disease-producing factors. So such is the quantity, large quantity present in the digestive system, which causes a condition which is known as dysbiosis. This dysbiosis is the disturbance of the gut, the intestinal, the large intestine, small intestine, the esophageal lining. There is some disturbance in this system. Due to that, there is production of leaky gut. This condition is known as leaky gut. So due to the leaky gut, there is increased intestinal permeability. You can see there is increased intestinal permeability. The gut lining becomes more porous. The condition is known as gut dysbiosis. There is complete disturbance of the gut. There is permeability is increased, and this increased permeability is the loss of oral tolerance. And due to this, there is a regular chronic low-grade inflammation. This chronic low-grade inflammation in the long run weakens the immune system, and this weak immune system is one of the most important causative factors for so many diseases, and one of them is rheumatoid arthritis. We must concentrate on this. There is chronic low-grade inflammation. This activates the immune system in the wrong way, and there are special bacterial triggers, alter bacterial metabolites. So all this causes a condition which is known as dysbiosis. It's very important. Nowadays, you will read, you will learn in all literature that rheumatoid arthritis and some other autoimmune disorders, they are part of this, and they always have some gut dysbiosis, due to which there is disturbance in the system, there is alteration of the bacterial metabolites. So gut bacteria produces inflammation. The name has been given SCFRA, that is short chain fatty RA, rheumatoid arthritis. There is often a reduction for anti-SCFA. This metabolic imbalance can produce so many things, and one of the disease is systemic immune activation is there. Very simple. There is immune activation, there is disturbance in the immune system, and this disturbance in the immune system causes a molecular mimicry. What happens when there is a molecular mimicry? The same which we had discussed in the last lecture, that your cells of your system try to attack your own immune system. That is mimicry, similar. So your cells which are responsible for the defense of your body try to attack your own cells due to this molecular mimicry, wrong diagnosis, wrong identification. They attack the cells, and thereafter, this due to low-grade inflammation for a very long time, the destructive processes start, and you may suffer from rheumatoid arthritis. It's a very new concept, but acceptable. This is an acceptable concept in all the literature. So please remind yourself, be ready, and the main reason, cause, treatment for this is all the medical science are accepting healing from inside out. All scientists are telling that there should be healing from the inside out. It means you correct your gut. That is what Dr. Herring told us. That is Herring's law. Healing from inside out. So nowadays they always say a happy gut is a happy brain. If your gut is happy, you have a happy brain. If you have a happy brain, naturally you have the force, the science, the moral, the power to fight with the disease. Now, something about the roadmap for treatment of rheumatoid arthritis. So what should be the roadmap? What should be the methodology by which we can try to cure this problem? The cure is comprised of your skill, your knowledge, your patience, and your observation. This depends independently with each doctor. So this is an art. That is why it is called an art. The roadmap for your treatment, for the process to cure, for the path to cure, for the road to cure is your own skill, your own knowledge. How do you apply your skill? How much you have a knowledge? How much patience you are having? That point of giving, after giving medications, you are not disturbed whether the medicine is working or not, if you are adhering to your principles. And very, very minute observation. And all these are qualities written in the organon of medicine. A very famous saying in the doctors are that if you fail to plan, your plan will fail. So you have to plan the line of treatment first and adhere to that plan as per the path shown in the organon of medicine. There are so many doctors who have described it in detail. You go to Kent, you go to other senior physicians. I don't want to name all of them, but there are physicians, there are doctors who have shown us the proper methodology by which we can cure a case. So cure is a combination of your own skill, your knowledge, your patience and observation. And don't forget, if you fail to plan your line of treatment, method of treatment, your plan will definitely fail. What we will stress is that we will have to treat these cases as per the plan of the organon. But in recent ages, in recent times, what has happened that a case of rheumatoid arthritis which comes to you is severe pain, swelling, stiffness, unable to walk. So there are so many things and the patient wants immediate relief. That is where the other medicines will help, the acute medicines will help. Otherwise, only cure is possible by this method. Roadmap for treatment, what should we do? Observation and analysis of miasmatic evolution of disease. You will have to understand the basic miasm which is behind this case, perceiving the miasmatic similitude. On the basis of miasm, the most similar medicine should be diagnosed. There should be individualization. There should be selection of a constitutional medicine, reversal of miasmatic progression towards health as per heredity. Without this law, without depending on this law, you will not be able to cure a case. There are two parts of the treatment. One is proper cure, by which you have to depend on this on for which. And second part is relief to the patient. Relief to the acute symptom is very important, because when the patient comes to you, I'll come to that, how is the patient composed? These are the different miasms. You will see rheumatoid arthritis is a chronic problem, chronic disease. So single miasmatic reference is several times not possible. Either it is a combination of psoriasis psychosis, psoriasis syphilis, psychosis syphilis, or combination of all miasms, depending on the intensity, depending on the chronicity, depending on the constitution, depending on the history of the patient, family history of the patient. So all these aspects must be taken care of for a proper cure. But basically, this rheumatoid arthritis is having a psychotic phenomenon. Most of the cases are having combination of psychosis predominantly, sometimes with psoriasis. So these miasmatic states do not exist in the pure form, either in physical or emotional manifestation. So good doctors say life is always a mixture. So life is a mixture of all miasms. You will have to recognize, you will have to know what miasm is predominant, what miasm is dominant, what is the constitutional medicine, what are the acute symptoms, and depending on all these aspects, if you try to cure, a patient will definitely be helped out. Dr. Luke Sheffer from US, America, he has given a very simple explanation. He is Dr. Luke Sheffer, very eminent physician of America. He has given a very nice, beautiful explanation, very simple explanation for a proper cure of a chronic disease. He has showed that the inside, most inside problem is a miasm covered by the constitutional symptoms and so many times covered by acute symptoms. This is how a disease is composed or a patient is composed. That there are always an acute exacerbation of symptoms. Rheumatoid arthritis consists of a miasm covered by constitutional symptoms, different to different medicines, and mostly covered with great intensity by acute symptoms. When you try to treat the acute symptom, then you will need, and the process of cure is that you first give acute medicine to the patient. You remove the acute miasm first. You can see this is a yellow one is the acute miasm. If we remove this acute miasm, the remaining things are constitutional miasm or constitutional part and the pure miasmatic part. You give a constitutional medicine to the patient. So if these symptoms, the constitutional medicines will work, then only miasm will remain. And you prescribe an anti-miasmatic medicine as per the symptomatology totality of the patient, and you will find it. He explained it very nicely, like an onion, we remove layer by layer, and then eat the onion. So that is what he suggested, that it is like an onion. To remove the acute miasm, acute symptoms first. Otherwise, they have already covered the complete miasms and constitutional symptoms. So there is some problem in diagnosing the exact picture of a patient. And when you diagnose an exact picture, try to give an anti-acute miasmatic medicines. That is where your Mathematica helps. The medicines which we will discuss today, that is mostly to remove this part, which is very difficult. You can give constitutional medicine, you can wait for the action of the medicine, you can give anti-miasmatic medicine, then again wait for the action of the medicine. But for acute miasm, you don't have time. So for removing the acute miasm, you must be aware of the acute medicines, which will help you. And that is where our lecture will concentrate today. So how SORA is there in the RA cases, there are so many explanations. There are syphilitic, there are psychotic, there are SORA psychosis, how the transition takes place. But in case of rheumatoid arthritis, the basic element is SORA. Therefrom, the gut. So the disturbance in the gut, if you consider that one part, so that starts from the soric miasm. There is exacerbation and remission, symptoms, pattern, flares, calmness, functional disturbance. There is pain, stiffness without joint deformity. Till the deformity takes place, there is a SORA. When the deformity is there, then it becomes psychotic miasm. So we should be very, very nicely aware of these things. The itching is a one part of the SORA we know, and the patient is always sensitive, irritable, emotional stress. This is a very rough presentation of a soric patient, of SORA miasm present in a case. And now the treatment part, if we will come to the treatment part, let us discuss in the beginning that what the best treatment available in allopathic side. So these are the things which are available in allopathic side nowadays, and very type of treatments. One, they give NSAID, non-steroidal anti-inflammatory drugs. So this non-steroidal anti-inflammatory drug, what they give, NSAID, anti-inflammatory, paracetamol, other medicines. The most important part for treatment of rheumatoid arthritis is DMARD, that we know as disease-modifying anti-rheumatic drugs. So these medicines are very common and very prominently used nowadays in practice. But you will not see a rheumatoid arthritic patient normally or generally coming to you directly. All of the patients come after getting treatment from different branches of medicine, and then they come to you. So when they come to you, this DMARD, they are always using under the influence of this DMARD, and DMARDs are, the most common DMARD is methotrexate. This is anti-cancerous medicine. But maximum in allopathy cases, you will find that the patients who are coming to you are under the influence of methotrexate. And there are some biologics medicine. These biologic medicines are specifically targeted for rheumatoid arthritis immune cells. Next, the very important and very latest therapy is CAR-T therapy. This is chimeric antigen receptor T cell therapy. Though very costly, very rarely used, but this CAR-T therapy has been very successful in treating cases of cancer. They produce this anti-immune cells, they manufacture anti-immune cell T cells, they genetically engineered. These cells are genetically engineered for you, and they give this genetically engineered by injections to your system, and this has been found very successful. It is not very common because it is very costly, but very effective. It has been found very effective in treating cases of rheumatoid arthritis and especially cancer. So in the coming years, you will find this CAR-T therapy becoming very common for the treatment. I will not discuss very common medicines. I'm very sorry to say, but I will not discuss very common medicines because all of us know about these medicines. For rheumatic pain, for joint pain, for rheumatoid arthritis pain, we know all the common medicines. Belladonna, Brine, Rustux, and other medicines. So we will just touch upon these medicines and try to go other part, which I prescribed or told you that we will have to remove the acute symptoms, the acute myasm. We will try to understand how we can remove the acute myasm. So these are the common medicines which we all know. Brine, there are joint pains, there is pain aggravated by movement, there is swelling, there is great thirst, there is irritability, the patient is fearful, wants to be alone, wants to go home, thirsty patient, aggravated by least motion. You can see the swelling in the joint. This is synovitis, inflammation of the joints with synovial things. So there is inflammation of the synovial joints, and these synovial joints, the pain are aggravated by motion. If this is aggravated by motion, the best medicine is Bryonia. Rustux again is a medicine which is good in these cases, but less prescribed because Rustux is a medicine for rheumatism which is related with gout. It is not a very good medicine to cure a case of rheumatoid arthritis where deformity is there, the synovial membrane damage is there, there is osteophyte formation, there is severe stiffness. So there is destructive processes are coming on. So in that case, Rustux will give only a temporary relief. All of you know, but Rustux is very commonly, very famous, it is known as rusty gate. What happens to a rusty gate? When you try to open a rusty gate, what happens? It cracks. It gives you great difficulty in opening the gate. But once you open the gate, it moves freely. So if the gate is rusty and have become stiff, so stiffness, rusty gate, starting movement is painful, and later on it becomes normal. So that is a Rustux. The Rustux most commonly is famous as rusty gate. There is stiffness of joints, better by movements. There is restlessness because he is better by movement, relief with movement, aggravated in cold weather, damp cold weather. Next is Belladonna, Arnica montana. So Arnica is the great painkiller. Bruised feeling is there, joint pains are there, but how will you recognize that you'll have to give Arnica? So this feeling is always there. This feeling is very important in case of Arnica. Feeling like anything they lie on is too hard. Arnica patient, where he lies on sofa, he thinks the sofa is very hard. He lies on the bed, he thinks that the bed is very hard. Everywhere he touches seems to be very hard and painful. This is a great peculiar sign for Arnica. And just opposite is a Baptisia case. In baptisia, wherever the patient lies, his parts become sore and bruised. So this is the small difference between arnica and baptisia. Wherever arnica lies, the bed seems too hard. Wherever baptisia lies, the body part becomes still. This is the basic difference between arnica and baptisia. But arnica is a very good medicine if there is a history of injury. The patient is having a profession where he is prone to injuries. In that case, to relieve the pain of the patient, swelling of the patient, you can give arnica. And this is very acute medicine, but very beneficial. That is belladonna. So belladonna is such a poisonous medicine, very, very poisonous, hence very effective. The more poisonous the medicine in homeopathy, they are more effective. So it is known as deadly nightshade. The name is deadly. The common name is deathberry. So by the common names only you can understand that how, but it is one of the best medicine to remove the acute myasm. Acute swelling, acute pain, acute fever, acute restlessness, acute headache. So all these things are very important when you see a case of belladonna. There may be fever, symptoms of beta virus, severe joint pain, redness and swelling, or aggravation by movement. And see, all symptoms are very violent. Violence is a keynote for a case of belladonna. This violence is visible in all conditions, mental as well as physical. See, this medicine was always feared as a poison, but valued as a medicine. It has been always feared by people as a poison in the old times, but has been found very valuable as a medicine. This is a very rare medicine, but very important nowadays, because nowadays Sarothamnus scopius. The Sarothamnus normally is not very used very commonly in cases, but it is minded. We have discussed in the last lecture that this is a disease, this is a problem, rheumatoid arthritis, when it affects the different systems. And when it affects the different systems, especially the cardiac system, this is the best medicine. Don't forget. If there is a case of rheumatoid arthritis, which is there, but have to consider that if there is cardiac involvement, you can see there is cardiac involvement. So if there is cardiac involvement, the best medicine is Sarothamnus. There are inflammation of joints, there are stiffness and pain in the joint, and one more peculiarity, benefit of this medicine is that this is a diuretic. This has a diuretic quality. So if you are having a diuretic quality, there will be more urination, there will be more and more water coming out from the system, so the swelling will come down. So the swellings in the joints may come down when you prescribe this medicine, but the peculiarity of this medicine is that the cardiac involvement should be there. If there is cardiac involvement, you can take help of this medicine, Sarothamnus. Next, very important medicine, very, very important medicine is formic acid. Mind it that this is one of the best medicines to relieve the patient in all conditions, in all steps, in all situations. It has been praised by the most eminent physicians. Dr. Herring proved this medicine. So it is made up from, formic acid is made up from ants, red ants. This medicine is prepared from venom of red ants. So red ants venom has been used through ancient times as a medicinal part, as a medicine. They used to take venom of the ant and apply to all injuries, apply to the swellings, and the patients felt better. So it is made up from the venom. And if the entire ant is crushed, one condition is when we take the venom of the ant, red ants, that is formic acid. If the complete ant is crushed, the name of the medicine is Formica rufa. Both are best medicines, one of the best medicines for treatment of rheumatoid arthritis. See what Dr. Boric has told. Dr. Boric, chronic joint conditions and muscular pain deserves more clinical application. Formic acid deserves, he is telling that it deserves more clinical application for this. And Dr. Nash has told, where deformity threatens and pain is deep-seated and tearing. So it is the medicine for pain, it is the medicine for deformity, it is the medicine to relieve the suffering. Dr. Farrington has told that this is useful in rheumatism of aged where other remedies have failed. So I told you to remove the acute condition, to help the acute condition, not the constitution, not the miasmatic, but to relieve the symptom, which is one of the most important part nowadays. This medicine will be very helpful. And Dr. Constant Herring, it has deep action on the muscles, joints, and fibrous tissues, effective in arthritis with stiffness, soreness, tearing pains, especially when aggravated by motion. And he tells that where nodular swellings or deformities begin. So can't you see that this is an exact picture of rheumatoid arthritis? Swelling, stiffness, pain, nodular swellings, and deformity. And Dr. Herring has told you can use this medicine in all these conditions. So nothing better than this. So we can try formic acid, and along with that, there is a medicine that is Formica rufa, which has been prepared by entire ant. This is prepared from venom of the red ant. And this is anti-inflammatory, reduces synovial inflammation, it modulates the immune system, it helps in reduction of pain, and it controls deformity. And all the great homeopathic physicians have prescribed. Very few, I have seen my practice life and during clinical meetings, very few doctors are using this medicine. This is one of the best medicine to relieve in gout also. Gouty arthritis, swelling, pain, fever, greatly help with this medicine. It should be prescribed from 6x to 30. And it works. In my clinical practice, I prescribe it very often, and it is very you see, we prescribe Dalcamara, we prescribe Urtica urens in gouty arthritis. So Dalcamara, Urtica urens, all these medicines contain formic acid. That is the active part of this problem. There is a research application that is Herring's lab. There was a laboratory established by Dr. Herring, that is Herring Lab. It is still present in Philadelphia, and they have done some research on formic acid and found it very effective for helping a case of arthritis deformance, swelling, stiffness, pain. Next is very important medicine, Chlorophyllum. It is very useful, very useful when there is wandering pains. So the peculiarity of this medicine is wandering joint pain, shifting joint pains. We have discussed in last class that the pain of rheumatoid arthritis is shifting. Though it is on both sides, but it shifts in the joints. So it is shifting, pains moving across different joints. Severe stiffness, symmetrical pain, weather sensitivity, weakness in hands. It is known as blue cohosh. The common name of this Chlorophyllum is blue cohosh. We always have one more medicine in homeopathy which is known as black cohosh. Do you remember? There is a medicine which is known as black cohosh, which is having similar medicines. Blue cohosh, wandering pains, black cohosh, wandering pain. Black cohosh, more neuralgic pain, wandering pains, and there is profuse bleeding, and the medicine is Actia racemosa. The black cohosh is Cimicifuga, Actia racemosa, and both are helping in case of when their pain is shifting. And this also is one of the best medicines. Propylamine, very, very great medicine for acute conditions. And I told you earlier also, today we will be discussing only mostly the acute things which will help you in our practice. The constitutional medicine, we can take the case, we can take the totality, we can repertorize the case, and we can come to a conclusion that what is the constitutional medicine as per the totality and what is the miasm beneath it. So we will give that medicine. Without that, cure is not possible. I repeat, without the proper constitutional medicine, without anti-miasmatic medicine, the cure is not possible. But in recent times, we have to give relief to the patient. And this is a medicine which is made from herring. Herring is a fish. The herring's brine. Herring brine is the thing by which this medicine is prepared. You can see this video. This is a fish which is taken out. In the sea, it is available. Sometimes they group together and they look like a ball. That is the peculiarity of this fish. And when they are put in the solution, that is known as herring brine, and that solution contains a chemical which is known as propylamine. And a great medicine for relieving the joint pain. You can see this is the ball-like appearance. These are the fish, and when it is kept in a solution, and that solution contains propylamine, the chemical propylamine, and when this was proved, there is acute shifting joint pains, inflamed swollen joints, rheumatic pains with heart involvement, and aggravation from cold, damp weather. So how does this act? It helps in the reduction of a chemical which is affecting the bones and joints and disturbing joint, that is prostaglandins. So there are chemicals known as prostaglandins, and these prostaglandins are reduced by the help of propylamine. And while giving propylamine, you can reduce prostaglandin, which are responsible for the joint destruction, which are responsible for the bone reabsorption, and their therapeutic target is blocking prostaglandins, which help to control inflammation. Propylamine, one of the best medicines. It reduces the prostaglandin, which are responsible for the bone destruction, for the swelling, for the pain. I think we are clear. And practice life, I can guarantee you that try this medicine for acute relief. And you will get beautiful result, beautiful result. I repeat, propylamine, Formica rufa, Formic Acid, these 3-4 are very nice medicines which will help you in practice life in helping the patients of rheumatoid arthritis. In my practice, I give these medicines. The patient feels better after some time, and that way you get a proper time to consider or to take the case properly, to revise the case properly, and prescribe an anti-miasmatic or constitutional medicine. And in this manner, the great success has been achieved in taking cases of rheumatoid arthritis. In practice life, you will see so many patients nowadays, so many patients. One medicine is Calmia, which is not very common, but this also is a very good medicine. There is stiffness and limited motions are there. Their motion movement sensitivity is there. The bruised sore pain is there. Grinding sensation is there. And mostly the pain are coming from above downwards. The calmia pains are neuralgic in nature, and they are shifting from above downwards. So there will be pain in the shoulder joint, the pain in the elbow joint, the pain in the small finger joints. Likewise, you will be having a history of the patient which is having tendency of the pain which is coming from above downwards. Then the medicine is calmia latifolia. Next, very, very important and miraculous medicine is chewing salt. I don't think that so many of doctors in homeopathy are using this medicine. The chewing salt can be used in curing or helping a case of rheumatoid arthritis. I told you about some medicines in allopathic that was known as DMARD, disease modifying anti-rheumatic drugs. One of them was hydroxychloroquine. You must have heard the name of hydroxychloroquine. Hydroxychloroquine is anti-malarial medicine. It is an anti-malarial medicine. It contains quinine. But in case of arthritis, especially post-COVID arthritis, I have seen, there are so many of my allopathic friends, they have been very successfully using hydrochloroquine as one of the best medicine to cure or help a case of severe rheumatic pains, joint pain, swelling, joint pains. You must have got the cases after post-COVID or after post-dengue. Post-dengue, post-COVID, there have been cases which have been helped by this medicine. And as we know that quinine, chewing salt is nothing but quinine. So I have tried chewing salt in very low potency, 3x, as a helping medicine. I repeat that this cannot cure a case, but this can definitely help. Try chewing salt when there is swelling and stiffness, weak and unstable joints, there is deep aching pains, better by warmth. And especially this is very useful in cases where the patient comes to you after an attack of COVID, dengue and other things with very similar symptoms like rheumatoid arthritis. So try this out. Then our favorite medicine is Medorinum. Need not go much detail for this because everybody knows that when Medorinum is used. So Medorinum is great antipsychotic. I told you in my earlier part that rheumatoid arthritis is basically predominantly psychosis is the miasm. So psychotic miasm, so this is great antipsychotic, and Medorinum is one of the best medicine for joint pain, all of us know. So there is family history, there is weather and stress, chronic joint pains, and there are joint swelling. And how is the patient? The patient is impulsive, forgetfulness, restlessness. These are the mental picture. The patient is impulsive, forgetful, restless, and all these features will help you to prescribe Medorinum, especially intercurrent. If you are treating a case, you are giving the most similar medicine to cure a case, but in the meantime, in middle intercurrently, we must use some anti-miasmatic medicine, and that best anti-miasmatic medicine is Medorinum. Again, some good medicines, some good medicines for helping a case of rheumatoid arthritis. One is Viola odorata. Viola odorata is rarely used, but it is very helpful in a case of rheumatoid arthritis pains. And it is a diuretic in action, it is anti-inflammatory action. And the most important thing in this medicine is that this is having milky urine. So if a patient is having milky urine, And this milky urine is there due to presence of fat, phosphate, and mucus. So if you go for a urine test, these things will be present. Milky urine with severe joint pains is medicine is Viola odorata. Viola odorata is also a very good medicine. Please note it down. This is one of the best medicines for curing a case of sinusitis. Very nice medicine when there are pain in the frontal sinuses. Frontal sinusitis and especially rheumatoid arthritis, and there is lithium carb. Lithium carb, there is chronic RA with cardiac complication. We have discussed one more medicine, salmonetus for cardiac complication, and this is lithium carb, which is also having with cardiac and nodules. Nodules are very prominent in lithium carb and they help a lot. In low potency, lithium carb is very helpful to help in case of nodules, swelling, tenderness, morning sleepiness. All these are cardinal signs of rheumatoid arthritis. Morning stiffness. In the first lecture, we have already discussed these things. Now come to this slide. Some specific medicines. We will be discussing some specific medicines which will be very helpful in your practice life. That is, if there is bone erosion, you can see the bone erosion. If there is bone erosion, the medicine is Ciphilinum and Formic Acid. If there is swelling of the synovium, the medicine is Brownia and Epismel. If there is cartilage wear and tear, the medicine is Calicarb and Causticum. Mind it, cartilage, we do not think about these medicines. We think, oh, there is a cartilage wear and tear, give Calcarea Phos, give Symphytum. But nobody thinks of Calicarb and Causticum. So mind it, in case of rheumatoid arthritis, Calicarb and Causticum should be thought of when there is cartilage wear and tear. And if there is reduced joint space, which is very common in case of rheumatoid arthritis, with Calcarea Flor and Phyllis. And I will add one more medicine. Please take it a note. If there is reduced joint space and cartilage wear and tear, prescribe Symphytum mother tincture. Don't forget Symphytum mother tincture in these cases as helping medicines. Next is, if there is severe pain in the joint, there is Actia spicata, Ruta, Goicum. These three are the medicines when there is severe pain in the joint, especially finger joints. Rheumatoid arthritis most commonly affects the finger joint. So these three medicines can help you. If there is redness, Belladonna, Ferrum Phos, Epismel. If there is edema, Epismel, Natrum Sulf, benzoic acid. But benzoic acid is more common for taking care of this case if there is gouty arthritis. It is less common to reduce the pains in rheumatoid arthritis, but it's very common when the case is of gouty arthritis. And if there is numbness, sometimes the patient will complain about the numbness. The fingers are not moving, the joints are not moving, they become numb. Then the best medicine is Causticum, Sickle cord, and Plumbum nut. You see how different are the medicines in homeopathy. How special we are, how special homeopathy is. All the different symptoms, all different medicines, but they help a lot to cure you a case. We have discussed swan neck deformity in case of deformities of the joints. There was a swan neck, the neck of a swan like this. This is a swan neck deformity. You can see this is a swan neck deformity. So there is a swan neck deformity. If there is swan neck deformity, the best medicines are Causticum, Goicum, and Rustux. The second type of deformity was there when the deformity was here. This deformity was known as Bottonier's deformity. We have discussed all these in the last lecture. So if there is Botaneous deformity, the medicine is again causticum, goicum, and plumbum metallicum. If there is metacarpal pain, and you see, these are the metacarpal joints. These are the metacarpal joints. So if there is pain in metacarpal joints, then the medicine is Chlorophyllum, Actia spicata 11. Sometimes you will see that when there is a development of carpal tunnel syndrome, in case of development of carpal tunnel syndrome, the metacarpal joints are affected and the median nerve is getting pressed. So when the median nerve is getting pressed, there is pain along the nerve to the above. So that condition is known as carpal tunnel syndrome, one of the complications of rheumatoid arthritis. And in that case, when there is pain in the wrist joint, when there is median nerve pain, the best medicine is Actia spicata. Don't forget Actia spicata, very good medicine. And specialized, when the localized on the wrist joint, Actia spicata, Rustux in Chlorophyllum, and please don't forget Ruta. Ruta again is a very good medicine if there is this kind of a pain. If there is cracking in the joint, there are cracking sounds in the joint. If there is cracking sounds in the joint, very often the patient will complain, it's paining, but it is having cracking sound. I do this, there is cracking sound in the joint. For specifically, there is cracking sound in the joint. The medicines are benzoic acid, causticum, nitric acid. Very rare, but nitric acid is also one of the medicines. There is stiffness, there is soreness, there is cracking of joint. Causticum and benzoic acid. But benzoic acid is more suited when the patient is suffering from gouty arthritis. It is very helpful when there is cracking pains in the joints, but in gouty arthritis, it is more usable. But if the symptoms agree, it can be used in case of rheumatoid arthritis also. There is deformity of joint. I am being very specific. I have discussed that the most important part is the anti-miasmatic and constitutional medicine. But beyond that, there are ways to help a patient. And these are the ways which have been helping me in my last 46 years of experience. I have been practicing and have been very successful in treating all these cases, depending special medicines, special symptoms. When computer was not there, I used to write down in the diary all the symptoms, rare symptoms, and I used to maintain that diary in my clinic. Now computer is helpful, very helpful. So if there is deformity, there are so many medicines we have taught, but the three best medicines are iodine. Iodine is very good enlargement and hardening of glands on joints, causing deformity. Joints are stiff. Pipermeth, very rare medicine, but very good medicine, especially if you concentrate on deformity of joint. There is pipermeth, there is swelling, there is tenderness in the joint, stiffness, aching may alter joint shape. So it is very natural. We have seen in several cases that the shape of the joint is deformed. In that case, pipermeth can be helpful. And very rare medicine, terebinth. Nobody is using this. Terebinth means kidney problem. But this has been very successful when there is swelling of the joints become hot, they may cause chronic inflammation leading to joint alteration. Synovitis, one of the most common complications, and there is epismel, there is bryonia, there is iodium, there is alicia. Bryonia is the best medicine if the patient is very thirsty. There is swelling, there is accumulation of synovial fluid in the joint. The same is in the epismel. But epismel is having burning pains, stinging pains, and there is no thirst. Epismel patient is not thirsty, whereas bryonia patient is very thirsty, and iodium is given when this case becomes very chronic. Alicia and iodium are the medicines when these cases become very chronic. Formation of nodules, all these are complications of rheumatoid arthritis. We have been seen. So if there are formation of nodules, the best medicine we have already discussed is lithium carb, Formica rufa, which we have discussed. Palicia is very good, Ruta is good, and one more medicine is there, that is Ammonphos. Ammonphos is very good when there is rheumatic nodules in fingers and painful and tenderness. So you can try all these medicines. This we have discussed, nothing more to discuss in this, that there is propylamine, Deformity, Chlorophyllum when the pain is in this joint, Viola odorata, Actia spicata, and Ruta. Ruta is one of the best medicine in these cases. And when there is shifting pain, very important, patient will always complain that the pains are shifting in the joints. The Chlorophyllum we have discussed, Pulsatilla we have discussed, Formica rufa we have discussed in detail, and propylamine. So concentrate on these 4 medicines when you have shifting, wandering pains, especially in case of rheumatoid arthritis. If it is not rheumatoid arthritis, then there will be other medicines, and very common, very beautiful medicine in such shifting pain is Abrotenum. Abrotenum is one of the best medicines in general, not in case of rheumatoid arthritis, if there are shifting pains. There is Actia racemosa, there is Pulsatilla. All these things are having shifting pain. With this, I would like to end my lecture on rheumatoid arthritis. Thank you very much for listening to me.
Thank you, sir. An excellent session. We were glued to the session. 2 sessions we had. We had a lot of medicines. You mentioned about dysbiosis today, the leaky gut. Everything, it was great, wonderful, and you touched a lot of medicines which we were not aware about. And you mentioned that, first of all, we need to deal with the acute symptoms, then constitutional, and then we need to go to the miasmatic medicines. These all things are real eye openers. And I know a lot of persons will be there to interact with you. But the thing is, now we are having very little time, and we have Dr. Ram Pravesh Shah with us. Sir, you can interact.
Thank you, Dr. Bindu Rajji, and Namaskar all, and congratulations, Dr. Kulwant Singh. Very nice presentation, excellent session. Rheumatoid arthritis, rare medicine, this is the rare medicine. Rare medicine, very, very good presentation and excellent session. Thank you, sir.
Thank you, Doctor.
Sir, Medorinum, one name, one dose, and arthritis, rheumatoid arthritis, the very good function.
We give in the same manner. We all
Miasmatic.
the anti-miasmatic medicine should be given in high potency, minimum doses, and it should not. That is the basic idea.
Thank you, sir. We will be greedily waiting again for your sessions. On behalf of IFPH, I am thanking you. And I thank you all who were here for this session. And it's time to start the Malayalam. Over to Dr. Shaila for the Malayalam session.